Pediatricians have noticed more children missing appointments as some parents avoid leaving their house. But a visit to the doctor's office is essential, and local pediatricians fear we could be dealing with much more than COVID-19 if children don't get those immunizations. Lauren Linville looked into this for us today, and she joins us now with more.
Local doctors I spoke with say pediatrics is a preventative branch of medicine. They're pushing to prevent illnesses that could bring more health devastation in the future. Local pediatricians are prescribing a warning of what missing appointments could look like.
Preventative medicine is what pediatricians do. Prevention works. Immunizations work. Well child visits work.
Dr. Terry Johnson of Pediatrics Associates says history shows without that crucial series of shots, infections and diseases like measles or meningitis could be on the horizon.
These are life-threatening illnesses that have a much higher mortality rate than coronavirus.
Even one child who succumbs to a preventable infection is too much.
Dr. Johnson says time is of the essence. Babies making appointments is a must.
They are born with their mother's immunity. So they actually have a good natural immunity initially to all these vaccine preventable diseases, but that immunity fades over the first 2 to 4 months.
Pediatricians like Dr. Johnson and Dr. Cheryl Humphrey-Francois, who works at the Community Healthcare Center, understand the fear that looms with getting out and about.
We spend a great deal of time on the phone talking with them. We ask them to give us any of their concerns.
Safety and comfort are the goals at Pediatrics Associates and the CHC. The American Academy of Pediatrics says it's reasonable to put off non-essential visits not associated with vaccinations.
Routine school health visits, or just visits of like the 3-year-old or 2.5-year-old, 2-year-old visits where there are no vaccines associated with them.
Skipping out on an appointment here and there may seem like no big deal, but these pediatricians fear the worst could be yet to come if little ones aren't taking a trip to the doctor. The CHC and Pediatrics Associates are screening everyone before they enter the building, keeping waiting rooms thin and always wearing personal protective gear.
Very good there. Okay, Lauren, thank you.